Hello everyone, my name is Aksh Patel and welcome to my channel. Today we are starting off with a new video on forensic medicine. I'll try to cover whole forensic medicine under 30 to 40 videos. And this is the first video, this is the first official video. I posted one earlier video about Asharam, but that was not a video about like from examination point of view. But today we are officially starting forensic medicine series, and in that first we'll be covering jurisprudence and later on other topics. And in jurisprudence, this is the first video about consent. I'll try to cover this video under 30 minutes, and in fact this is an important question from university exam point of view. And this is recently asked in many universities like Gujarat University, Saurashtra University. They asked this question. So without wasting the time, let us start a video on consent. Okay, so first of all, what is consent? So consent is simple, like it is a voluntary agreement, compliance, or permission between two people. Two people are said to consent each other if they agree upon the same thing in the same sense. Like the definition is simple. You don't have to remember the exact words. Just remember that is an agreement between two people. That's it. Now, what is important is the classification of consent. So we'll quickly go through the classification. Okay, so consent is basically divided into two subheadings. That is, one is implied consent and another one is expressed consent. Okay. Now, implied consent includes gestures, body language, etc. Now, if a person has gone to the hospital to show his or her skin to the dermatologist, then of course the consent is given. Why would I have gone to the hospital? Of course, to show. So there is no need to take like written consent or that. Body language itself shows that he has come to the hospital to show his acne or any other problem to the doctor. So doctor can see without taking the consent. Okay, so that comes under implied consent. The another one is expressed consent, sorry, and it is further divided into verbal and written one. So let us quickly write. One is verbal one and another is written one. Okay, now verbal is sufficient for some minor treatments or minor procedures, but written consent is needed in major treatment or some kind of anesthetic procedures. Okay, simple. Classification is very simple. One is implied, another one is expressed. Implied includes gestures and body language. Expressed includes verbal and written. Verbal means like speaking, and written means there is a specific form. I don't know the form number, but there are several forms for consent. Okay. Okay. Let us move to the next uh, kind of consent, but that is not followed in India. And those are, one is surrogate consent and another one is blanket consent. Surrogate consent is when like people close to the patient, but patient does not, like patient, if patient is unconscious, then who will give the consent? Of course, his guardians will give, his or her teacher or warden, anyone who is in whom the patient is in custody. Okay, so that is surrogate consent, like someone other than patient gives consent. Another one is blanket consent. Blanket consent means as soon as the patient or his relatives enter the hospital, on the reception desk itself all the consent are taken. So like consent for examinations, consent for treatment, everything under one desk. Consent, like I've written here, like consent for all procedure taken during admission. So this is not followed in India. Okay. The another thing which we have to remember about consent is doctrine of informed consent, and the other one is doctrine of loco parentis. Okay, so what is doctrine of loco parentis, or what is doctrine of informed consent? So informed consent includes complete information has to be given to the patient before taking consent. So for example, if you are taking a consent for doing some kind of operation, then you have to give each and every chunk of information to the patient before taking his consent for doing operation. You have to tell what are the side effects, you have to tell what will be the cost, what are the risk factors associated to this operation, everything you have to tell. But there are a few exceptions where consent need not be taken. And these exceptions are in cases of emergency. If patient is dying on the bed, then you cannot wait for the consent to happen. Okay. Another one is therapeutic privilege. The therapeutic what is therapeutic privilege? So there are a few diseases, there are a few vulnerable diseases that can't be told directly to the patient because patient may go in mental trauma or he may become depressed. Like for example, if patient is in stage 4 cancer, then you cannot directly tell you have cancer. He may go in depression. So this like therapeutic privilege means don't lie, but also don't tell the whole truth. Okay, in order to save patient from going into depression. That's it. Another thing is therapeutic waiver. What is therapeutic waiver? It's just like therapeutic privilege, but in this case, patient himself tells the doctor that, hey, doctor, please don't tell me anything. Like, don't tell me what are the reports going to be. That is therapeutic waiver. So in that case, also doctor don't need to tell. Another thing which in which the consent is an exception is use of placebo. Okay, so 1 minute. Use of placebo. Uh, Another thing is for prisoners. So to prisoners you don't have to take consent. And the last but not the least is medical legal postmortem. So these are some of the exceptions. You can remember 2, 3. That will be enough to pass your university exams. Okay. The another doctrine is of loco parentis. Just remember, parentis means parents. So in the absence of parents or guardians for children below 12 years, consent is obtained by person in charge, like teacher or warden. Simple. Okay, so we have studied two doctrines. One is doctrine of informed consent, means patient has to be given all the information, like a whole chunk of information. And another one is doctrine of loco parentis, means if the child is below 12 years and he or she doesn't have his parents or guardians, then consent can be taken from one who is in charge of him or her. So teacher or warden, anyone. Okay. Now this is the last heading which you can write if a short note is asked for consent, and these are the rules for the consent. So I've followed a book called Gautam Bishwas for forensic medicine, and in that more than 20 rules are given, but you don't have to remember all the 20 rules. I've written some 5, 6 rules which you can write as such in university exams, but you can also read Gautam Bishwas. It is a very fantastic book. Okay, so the first rule for the consent is consent should be free, voluntary, clear, intelligent. No fraud, no intoxication, and no coercion. In short, consent should be simple and self-explanatory. Okay, that's it. The second point about the second rule about consent is of medico-legal examination. So the minimum age for consent is 12 years for physical examination. Okay, and it is 18 years for some major procedures like surgeries or like that. Okay. Okay. Now the third rule is of rape, examination of rape. So for victim of rape, you have to compulsory take consent. So consent is must. Okay. And for accused, it is not needed. Okay. The fourth point or the fourth rule is of MTP, medical termination of pregnancy. Okay. So for MTP, consent is a must. So for women above 18 years, she can give the consent. Okay. But if she is below 18 years, legal guardian can give the consent. Okay. And cherry on the cake is husband's consent not needed. The fifth rule is in case of emergency, if a doctor does some kind of harm without taking a valid consent, so that is not considered as a liability to the doctor. Okay, so I've written here any harm to the person in good faith, even without his or her consent, is not an offense, but this is applicable only under emergency cases. And the sixth point is of organ donation, like after death. So in that, will of the person is enough. If a person has already made a will that after death, my liver will go to this hospital or donate my eyes to someone who is blind. So will of the person is enough to do organ donation. But what if after death, his or her son make the claim that I am not going to donate anything? So in that case, a dead man doesn't have any control over his body. So his or her son or relative have complete right over the deceased body. So final decision will be of those nearest relatives. Okay. So these are the six consent or like rules for the consent. We have seen two doctrines. We have seen the classification and definition. So just four things. One is definition. What is definition? That is the simple agreement or some kind of permission between two people. The second thing is classification. Third is like we see two doctrines, and fourth are the rules. Okay, so these four things you have to remember about consent, and this is asked as a 6 marker short note. Hope you like my video. Subscribe if you like my video. I'll be uploading 2 videos every week if I get the time from my academics. Okay, hope you like my video. Thank you very much.